Oh, I believe I may have been muted for that. I'm sorry. Hello, and thank you everybody for joining the Health Effects Institute 2021 webinar series. My name is Eva Tanner, and I'm a consulting staff scientist here at HEI. Before we delve into today's webinar, I'd like to make a few housekeeping announcements. All attendees are muted for the duration of the webinar. There'll be a 5-minute Q&A period after each speaker reserved for short technical questions, and in-depth questions will be reserved for the 20-minute Q&A and discussion period at the end. Please submit your questions via the Q&A function at any time during the webinar, and you can also upvote questions in the Q&A. If you experience any logistical difficulties, please contact us using the chat box. And to help improve our webinars, please complete the post-webinar feedback survey, which will be emailed to you sometime tomorrow. And now I'd like to introduce our president, Dan Greenbaum.
Good morning, and good afternoon, and good evening. I'm very pleased to welcome you all to the first session of HEI's virtual annual conference for 2021 on climate change, air quality, and health. I'd like to acknowledge right from the start the Hei Co-Organizers of today's session, including staff scientists Eliane Van Vliet and Eva Tanner, who you just heard from, and HEI Vice President Bob O'Keefe, as well as all the staff who work behind the scenes to put this webinar together. We have a very interesting session for you today. To lead our way through it, it's my honor to introduce today's session chairs, Dr. Melissa J. Perry, Professor and Chair of the Department of Environmental and Occupational Health at the George Washington University Milken Institute of School of Public Health, and Chair of the HEI Review Committee, and Dr. Frank Kelly, the Humphrey Babcock Chair of Environment and Health and Director of the Environmental Research Group at the Imperial College School of Public Health. And he is also a member of the HEI Review Committee. Dr. Perry will lead off.
Thank you so much, Dan. It's great to see you, and it's fantastic to have such an audience join us today. We have a distinguished panel of speakers. There's no better time than right now to be talking about these important intersections between climate change and air quality. And we have very well qualified presenters. We'll be hearing from Neil Fan from the U.S. Environmental Protection Agency, Tracy Holloway from the Wisconsin-Madison, also Rachel Morello-Frosch from the University of California, Berkeley, and also Sonal Jessel from We Act. Next slide. Here's our agenda. We're hoping you can join us for the whole session. We'll be hearing from each of our panelists. Dr. Kelly and I have the unenviable task of being strict timekeepers, so we can keep to time and make sure that there's enough time for a robust discussion at the end with our panelists. We'll be hearing first from Neil Fan. He'll talk to us about, can we avoid the climate penalty, reducing emissions to counteract climate effects on air quality and health. After Neil, we'll hear from Tracy Holloway. She'll be talking to us about health and air quality benefits of energy system change. Following Tracy, we'll hear from Rachel Morello-Frosch, integrating justice and sustainability goals into climate change policy in California. And finally, we'll hear from Sonal Jessel from We Act, and she'll be talking to us about extreme heat and public health. Then we'll be having a moderated Q&A session, so please do, excuse me, send along your questions in the using the Q&A function, and hope that you can join us for the whole time, and we'll hear from Dr. Kelly at the end with some concluding remarks. So with that, I say welcome, enjoy, and I'll turn things now over to Frank.
Thank you, Melissa. It's my pleasure to also welcome you all to the meeting today. We're going to start, as Melissa said, with our first speaker, and that is Neil Fan. Now, Neil is the Senior Policy Analyst at the U.S. Environmental Protection Agency. And he has 15 years of experience in quantifying and monitoring the benefits of improved air quality. Neil's research interests include estimating the health burden of poor air quality and characterizing the health impacts of air pollution on susceptible populations. Neil earned a Master's in Public Health Policy from Duke University, Stanford School of Public Policy in 2003, and is currently pursuing a Master's in Public Health and Epidemiology at the Harvard Chan School of Public Health. Over to you, Neil.
Frank, thanks so much for that introduction. Give me just a moment while I share my slides. All right. Excellent. Presumably someone will tell me if they can't actually see these. So Frank, thank you again for that introduction. I'm both thrilled and honored to be here. I regret that we can't all be here together in person, but who knows, perhaps this time next year we will be. So I'm going to talk about a research project that my colleagues and I undertook last year. And the goal was to answer two related science policy questions. The first was, how big will the climate penalty be in future years, in particular in the late century? At the risk of oversimplifying, the climate penalty describes the influence of future changes in climate on air quality and the extent to which climate would be expected to degrade air quality, other things being equal. The second question we wanted to answer was, given what we know about federal, state, and local air quality policies, to what extent will reducing emissions as a result of those policies either blunt or perhaps even reverse in some cases the climate penalty by late century? Before I get into the substance of the discussion and the research project, I wanted to first acknowledge the considerable efforts on the part of my colleagues to bring this project to fruition. My colleague in the Office of Research and Development, Chris Nolte, was instrumental in performing both the climate modeling as well as the air quality modeling simulations. Jeremy and Marcus each helped provide the basis for the article and developed what I think is a pretty clever reduced form approach for quantifying the human health impacts of changes in temperature that I'll talk a little bit about during this presentation. And then Nicholas Nasikas at the time, or is a pulmonologist, and at the time was at Brown University. He helped provide some helpful feedback on how we characterize the human health impacts of air quality changes. And of course, as always, for presentations such as these, you should interpret these findings as, and any reflection on the findings as mine alone and not necessarily the policy of the US EPA. Okay, next slide here. So the interrelationship between climate and air quality is, as many of us can appreciate, incredibly complicated and frankly beyond the scope of the time that I have today. But I think there are a few key facets that are worth noting before we get into the results of the analysis. This figure is drawn from the National Climate Assessment, the fourth National Climate Assessment, which in turn adapted it from Arlene Feuer's excellent 2015 paper. The key point is climate obviously affects air quality and air quality affects climate. So we would expect future changes in climate to increase temperature, which of course promotes the formation of ozone. Future changes in climate can also be expected to promote stagnation events, which would increase the, other things being equal, increase the level of ground level ozone in the future. It also has, as I understand it, a more ambiguous effect on PM. But the key takeaway here is that we expect changes in climate to affect air quality, and of course that will in turn affect health. Likewise, there's an influence of air quality on climate in the form of short-lived climate pollutants, ozone being one of them, black carbon being another. That was beyond the scope of this particular analysis. We were really targeted specifically on understanding how much harder, how much worse is air quality going to be in the future as a result of climate change, and how is that going to adversely affect public health. So we ran the analysis using a series of models and tools, including two global climate models, the meteorology of which was taken from those climate models and downscaled, and then served as an input into a photochemical model called CMAC, and then that was then passed to a tool to calculate human health impacts called BenMap. Worth noting here, because of time and resource constraints, we were limited in the number of what are called representative concentration pathways, or RCPs, that we could run. And we chose 8.5, which is a higher warming scenario. So taken together, we ran all of these models and tools to help answer this key question, which is how reducing anthropogenic emissions might blunt the climate penalty. And the way in which we wanted to help answer that question was by simulating two different emission inventories. An emission inventory is simply a projection or an expectation of how anthropogenic emissions are going to change over time. One that was pegged to the year 2011, and then one that was pegged to the year 2040. The 2040 inventory obviously accounting for a larger suite of what we call on-the-books emission controls. So I guess first, the not so great news that won't come as a surprise to very many of you on this webinar, that we expect, climate is going to increase future temperatures. These four maps are depicting the results of two different climate models simulating temperature in the future, both in early century, which we defined to be 2030, and then late century, which we defined to be 2095. These results are as compared to early century, i.e. year 2000. Each climate model predicts increases in future temperature. The CESM model predicts warming by up to 10 degrees late century, particularly in the West, whereas the CM3 model predicts elevated temperatures, largely in the Midwest and to a lesser extent in the Northeast. So the good news is that we can expect anthropogenic emissions to fall, in some cases pretty precipitously, between the years 2011, or I'm sorry, between these two inventories, 2011 and 2040. So that includes VOC, NOx, directly emitted PM2.5, and SO2. Some or all of these are precursors to either ozone or PM. So it's reasonable to expect that as a result of reducing these emissions, you would also expect to see a drop in ozone and PM. And so the question was, notwithstanding these increases in temperature, which are going to in turn promote formation of ozone in the future, and other changes in climate that will affect the promotion of PM2.5 in the atmosphere, to what extent will reducing these emissions from this full suite of federal, state, and local rules, how is that going to affect air quality and subsequently health? So what's interesting is when you look at the change in ozone, the late century predicted ozone concentrations as compared to early century, you do see increases, certainly under both of the climate models. But perhaps not surprisingly, when you simulate those changes using a 2040 inventory, you get smaller peak levels. And you also get, as I'll talk about in just a moment, lower overall impacts to health in the form of attributable mortalities. What's also interesting and worth noting is that the influence of climate on air quality is not universally or uniformly negative. In fact, in some locations of the US, particularly in the Southeast, you actually see decreases in ozone. For PM, I thought I would plot the air quality distribution to estimate the change in population exposure. So here what we're seeing is the cumulative distribution, or percentage, I should say, of the US population exposed to different PM levels. So if you follow the numbers, starting with number 1, that curve is representing the distribution of exposure in the year 2000, assuming 2011 emissions. Curve 2 is modeling 2095, i.e. late century exposure using 2011 emissions. Curve 3, which shifts to the left, compared to curves 1 and 2 is showing you the drop in exposure as a result of simulating PM using the 2040 emissions inventory. And these are population normalized, by the way. So I think what this implies, or at least gives us evidence for, is that if you are reducing emissions under the 2040 emissions inventory, you can actually counteract, if not completely cancel, the climate penalty on PM. These next couple of slides are illustrating the number of ozone and PM attributable deaths, population normalized. So these are expressed per 100,000 people. The ozone-related deaths were quantified, or attributable deaths were quantified using an odds ratio from the Zanabetti-Schwartz paper, which I think was published in 2008. And you can see, if you look at the difference between the impacts using the 2011 inventory and the 2040 inventory, you see a reduction in both the overall burden and a shift in the spatial distribution as well. Likewise for PM, although the pattern is reversed for reasons we're still exploring. Note also that the scale is quite different here, because whereas with ozone, we were estimating short-term attributable deaths. In this case, we're estimating long-term exposure attributable deaths using a hazard ratio from the Kruski reanalysis or extended analysis of the American Cancer Society cohort. These results are not population normalized, and this figure is a little bit complicated. So let me walk through it very carefully. The intensity of the blue indicates the overall size of the ozone and PM attributable deaths. The line graphs on each state are depicting a time series of the number of ozone and PM related deaths in each time period. The black line is depicting the number of ozone and PM deaths quantified using the 2011 inventory, whereas the blue line is quantifying those using the 2040 inventory. To the extent that the lines diverge in many states, that's indicating that the 2040 inventory is generating or yielding a smaller overall number of PM and ozone related deaths. The final set of results I wanted to show you was this, I think, very clever reduced form approach that my colleagues developed, which relates changes in air pollution related deaths to 1 degree by 1 degree changes in future temperature. This type of reduced form approach can be quite helpful when you have results from other climate models that are predicting annual mean changes, or annual mean changes in temperature, and could be used to basically generate a screening or an order of magnitude estimate of the human health impacts associated with those changes. I just wanted to wrap up by describing a few of what I think are an almost unbounded number of areas for future research. The figure on the right is drawn from an article recently published by Newman et al., where the authors quantified the influence of climate on future wildfire activity and explicitly modeled the fuel availability and distribution, which I thought is a great advancement to the literature. I think it's exactly the type of work that's called for. There's a lot more work, I think, also to be done to understand how climate affects air quality, considering alternative representative concentration pathways. So not just 8.5, but perhaps also 6.0 or 4.5. I'm also interested in understanding the extent to which, obviously, air quality affects climate. We did not, in this research project, try to account for the influence of reduced short-lived climate pollutants on future warming. But that's certainly, I think, a worthwhile area of future research. I'd also be interested in learning a little bit more about how we can account for effect modification by such factors as air conditioning, or, for example, looking at the effect modification of temperature on ozone-related mortality. So in other words, I think more clearly identifying time varying factors that are climate sensitive that might help us refine these estimates of future estimated health impacts. And then as other speakers during the webinar today will address, there's a lot of research questions related to environmental justice impacts. As I showed on the previous slides, the distribution of air quality impacts is not uniform across the US. We know very well that there are certain populations that are susceptible or vulnerable to PM and ozone. And I think it would be quite useful to understand the extent to which climate change is differentially affecting those populations. So just to wrap up, 3 key conclusions I wanted to leave you with. First, clearly future changes in climate are going to degrade air quality. The good news is that already instituted policies or already planned policies can mitigate or maybe even reverse the climate penalty, and that we have a new set of reduced form relationships available that help us more quickly, easily characterize the influence of temperature on human health impacts of air quality changes. So with that, I'll wrap up.
Thank you very much, Neil, for that excellent initial talk in this session. We have a number of questions that come up, but I'll start just with the technical one. And this question is, anthropogenic VOCs may drop, but with increasing temperatures, biogenic VOCs will likely increase and dominate in certain areas in terms of ozone and SOA production. Did you factor these issues in to the modeling?
That is an excellent observation. And to my knowledge, no, we did not make an explicit attempt to factor in biogenic VOCs. That would be another excellent area of future research.
Okay, thank you. There's another question around what CO2 reduction did you assume?
So we didn't, within this particular project, we didn't explicitly model changes in CO2. I mean, we were using representative concentration pathway 8.5, and so we would have reflected whatever CO2 changes were associated with that RCP. The focus of this particular work was simply the air pollution related impacts. So we were most interested in simulating changes in future levels of ozone and PM 2.5.
Okay, thank you. We have a question now about ammonia emissions from agriculture and whether these respond to future climate change scenarios in the models that you ran.
Yeah, that's another great question. I don't believe that in this work we explicitly accounted for ammonia, but I agree that when you're simulating future changes in PM, it would be important to do so. Don't hold me to this, but I'm reasonably confident that we didn't explicitly attempt to simulate changes in ammonia. Okay,
and likewise, you mentioned short-lived climate forcers, and there's a question about whether you'll be looking at a full spectrum of those in future work. Obviously, components of PM that not only warm but also cool, and the net effects of policy changes and really outdated forcing.
Yeah, that's an excellent point, right? I mean, to the extent that you want to better understand the role of these emission changes on climate, you'd want to account both for changes in black carbon, but also sulfate particles. So you basically, you'd want to take a holistic view to be sure.
And then maybe we'll just finish on this one, Neil, a bit provocative. Is there really a need for additional research, and wouldn't it be more effective to spend time and money on implementing behavioral changes by corporations and individuals?
I can say confidently that that is beyond my writ, so I'm not even going to attempt to answer that.
Okay, thank you very much, Neil, and we'll come back to you for the final Q&A. Thank you again. Handing over to you, Melissa.
Terrific, Frank. Thanks so much. That was really a fascinating presentation. Really delighted, and it's my pleasure to introduce Dr. Tracy Holloway. She is the Gaylord Nelson Distinguished Professor at the University of Wisconsin-Madison, with joint appointments in the Nelson Institute for Environmental Studies and the Department of Atmospheric and Ocean Sciences. She's an air quality scientist working at the intersection of air quality, energy, climate, and public health. Dr. Holloway also serves as the team lead for the NASA Health and Air Quality Applied Sciences team, which connects NASA data with stakeholder interests in air quality management and public health. She earned a PhD in atmospheric and oceanic sciences from Princeton University. Dr. Holloway, please take it away.
Thank you so much. It's really a pleasure to be here, Melissa, and I really enjoyed Neil's talk a moment ago. I'll be switching gears now to talk about the potential win-win solutions of taking action on climate change and how those can also benefit public health and make our air cleaner. So I'll be kind of giving an overview of this topic today, but drawing very heavily from a recent review article that was published in Frontiers in Public Health that was led by my PhD student, Kieran Gallagher, and had funding from the Joyce Foundation, as well as the University of Wisconsin-Madison. And this article is open access and publicly available online. So if anybody wants to look it up and follow along, we'll be kind of stepping through some of the big conclusions there. To start out, I want to say that in the United States, air pollution has been going down, dating back to the formation of the EPA in 1970 and the Clean Air Act in 1970. And I think a lot of people don't realize that across the United States, air pollution in many ways is a success story. All of the 6 major pollutants regulated as criteria pollutants have been going down, even as our economy has gotten bigger, we drive more miles, our population has grown, our economy has grown. But one thing that hasn't gone down is carbon dioxide emissions. And those are of interest for climate change. And of course, that's the topic of today's session. But just to sort of focus a little bit more on the successes that we've had, it hasn't been across these 6 that some have gone down and others have gone up, but in fact, all 6 of the criteria pollutants have gone down. And this plot goes to 1990, the previous one to 1980, but these trends go all the way back to 1970. So we've had decades and decades of experience controlling air pollution. Nonetheless, about almost half of the United States population lives in areas that are deemed above the health-based standards set by the US EPA. So this is still a big challenge. And we've achieved these reductions with an enormous investment. We spend about $50 billion with a B dollars a year to remove pollutants, usually before they get into the atmosphere through scrubbers on power plants or cleaner burning engines. So the investments that we've made through mostly technologies have been motivated by policy. And for many pollutants, they've worked, but they're expensive. We can see that they've been working through ground-based measurements. The EPA and states and tribes run thousands and thousands of instruments across the United States that detect these reductions, these patterns, and that's what you're seeing here. We can also see the reductions from these health-relevant air pollutants from space. And as I was mentioned, I lead the NASA team connecting satellite data and other NASA tools with health and air quality. And this is an example of the kind of information you can see from satellites. This is nitrogen dioxide, the main component in the atmosphere of NOx, which creates PM 2.5. It creates ozone. It's a health damaging pollutant on its own. And you can see huge reductions between 2005, which was the first year that the satellite called OMI was orbiting, and that's the data that I'm showing here, all the way down to 2019. And really over this time, many cities had reductions of over 40% in NOx emissions due to cleaner engines on cars and trucks and cleaner burning power plants and industrial processes. But there's a missed opportunity. We're tackling all of these reactive pollutants, but we're not doing too much to directly address carbon emissions. And there are so many opportunities to have a double win because transportation, for example, is almost a third of our greenhouse gas emissions, and it's over 50% of our nitrogen oxide emissions. Electricity is also about a third of carbon dioxide emissions, and it's over 80% of our sulfur emissions. and about proportional to carbon in our nitrogen oxide emissions. So anything we do, almost anything we do to move away from fossil fuel burning is a win-win for air pollution, which we're already spending billions and billions to control, and a win for public health. One way to think about this is that then anything we do to solve climate will impact greenhouse gases and lead to climate benefits, but it will also reduce all of these other co-emitted pollutants. And this is often called co-benefits, these sort of extra side benefits that you get for climate. I think that whether it's or the goal is really in the eye of the beholder, because we've been controlling air pollution to protect public health for decades. And whether you consider the climate as the goal and the health the co-benefit, or the health the goal and the climate the co-benefit, I think there's no question that there are win-win opportunities that have not yet been fully realized. One of the challenges to this is that the research on these topics are vast, and it spans everything from electricity and transportation to atmospheric chemistry. And so my graduate student Kieran Gallagher and I set about trying to summarize what do we know from the work that's been done to quantify the health and air quality benefits of specific carbon reduction strategies, specific strategies for clean transportation or clean energy or clean electricity or energy efficiency. And so when we look at the peer-reviewed literature, and this is from the Clairviet Analytics, if you think about what we know, what's been published around climate and health, there's over 28,000 publications. Around air pollution and health, over 25,000 publications. But just a small fraction of the literature deals with the overlap of how health, climate, and air pollution can be addressed in one go. And we wanted to focus on a very, very specific subset of this literature. We wanted to know, what do we know where air quality has been quantified from climate mitigation strategies? And we want to go all the way to air quality and often health. We don't want to just stop at the changes in emissions. And there is a huge body of literature that didn't fit this very specific subcategory. And it can be about optimization methods, or zeroing out a particular pollutant, or looking at, like Neil Pfan's talk did, the climate impacts on air pollution, life cycle assessments. So what I'm presenting here is by no means the soup to nuts of this important topic, but it is a summary of when researchers have taken specific technologies and policies and carried them through using systematic quantification methods to calculate the air quality and often health benefits. And of course, we've benefited from a lot of the work of Neil Pfan and many, many others. When we look across this literature, we found about 26 studies that fit these very specific criteria. Of these, some were quantifying the health benefits or air quality benefits of climate policies. Some were looking at changes in electricity, and some were looking at changes in transportation. You can see that this is a somewhat of a growing field, but most of the work has been done in the past 20 years. And what I'm going to summarize now are what we found as the consistent findings across this review of the literature. And I'll be honest that some of the studies that we referenced here were ones that my research group has been done. I've been working at the University of Wisconsin for about 20 years and working in this field almost the whole time. And so to illustrate some of our systematic findings, I'll be showing a couple plots, some of which come from my own team's published work. But one of the things we found across all of the studies is that decreasing fossil fuel use reduces emissions and improves air quality. This is not surprising. I set it up for you at the beginning, making the point that if you reduce CO2 from transportation, you're accidentally reducing NOx as well. But it was nice to see that this is a consistent, robust finding that comes across many, many studies. And I want to illustrate here with a study that my former graduate student, David Abel, and I and colleagues did in 2017. where we quantified how air quality would respond to changes in, to increased use of solar energy. And you may say, okay, solar energy will reduce emissions, it will improve air quality. But one of the questions is, does it improve air pollution on the cleanest days, making the clean days cleaner? Does it reduce air pollution on all the days? Or does it have the biggest impact on the dirtiest days? And from a regulatory perspective, from a health perspective, tackling air pollution on the dirtiest days is really what we want to do. So in this plot, what you're seeing are model simulations from one of the same models that Neil Fan talked about in his talk, the EPA Community Multi-Scale Air Quality Model. And we considered the Eastern United States under a business as usual case. And in the on the x-axis, you see what PM 2.5 levels would be under business as usual. And then on the y-axis, you see the reduction in PM 2.5, where each dot is a different day in a different city. And what you see is on the days that would have had the highest levels of PM pollution, those are the days that have the highest reduction due to solar energy. So this is just what we want to see. We also see that different cities have a different relationship, and cities like Indianapolis, Indiana, and Columbus, Ohio, which are proximate to coal-fired power plants, see a bigger reduction due to solar energy because their nearby power plants are the ones that are turning off when we have more renewables in the case of solar with the study. Another conclusion that we found looking across all of these review articles was that reductions in PM 2.5 yield the maximum health benefits. And I think it's important to know that PM 2.5 has been directly linked to premature mortality. And this yields the highest public health benefits. Anything you can do that avoids people dying, that increases life expectancy, this is going to get you the biggest win, especially when you put dollar figures on it. The US EPA gives a guidance of the value of a statistical life as being $7.4 million. So when you have a large population that is exposed to cleaner air, even a few avoided deaths translates into very, very large economic benefits. So there are a lot of different benefits of cleaner air, a lot of different health outcomes that we could talk about, but when you translate it into dollars, PM 2.5 and mortality is really the nexus that leads to the highest monetized benefits. Another conclusion across our studies was that displaced coal generation and population exposure strongly affect co-benefit valuation. And this was actually illustrated in the plot that I showed earlier, where Indiana and Ohio had the highest benefits from solar energy. And this is because when you have a lot of coal-fired power plants, anything that you're doing that uses those less is making the air in the neighborhoods where those power plants exist, the regions, the states, cleaner. And what I'm showing here is a map of power plants across the United States from the Washington Post. And you can see the kind of gray and black dots centered in the Ohio River Valley down into the southeast show the locations of coal-fired generation. So that is where we have a lot of people living, a lot of emissions. And so anything that can be done to reduce the fossil fuel burning in these plants tends to have the highest impact on public health. Another conclusion we found looking across these 26 studies is that for the studies that monetized the benefits of climate policies and compared those to implementation cost, the monetized value typically exceeds the implementation cost. In other words, if you include health and include air quality in your cost-benefit analysis, you come out in the black. The cost of implementing a policy is outweighed by the benefits. And so this is a really big conclusion, and it's one that was consistent with a study that I worked on with my colleague Greg Nemeth and Paul Meyer back in 2010, where we did a similar review of the literature and found that the benefits of a climate policy were similar to the cost of the climate policy if you included health and air quality. Some of the newer studies referenced in our paper actually find even more optimistic results about the benefits of including health. The final conclusion from our paper is that some energy strategies do yield a mix of benefits and disbenefits. It's mostly a win-win, but sometimes there are issues that need to be taken into account. And one of these is dealing with ozone. Ozone is a complicated pollutant that cooks up in the atmosphere and is created by nitrogen oxides and volatile organic compounds. But sometimes if you have very polluted conditions, you have so much NOx that it's reacting with the ozone, which is to say that when you reduce this ingredient of NOx, your ozone that you're concerned about can actually go up, kind of this springback principle that sometimes happens in nonlinear systems. And an example of that was shown in a study that my team did with Maggie Grabow, one of Jonathan Patz's graduate students, and Jonathan Patz here, where we looked at bicycling across the upper Midwest of the United States and found that increased bicycle use, to like extreme assumptions about increased bicycle use, would be a net win everywhere for particulate matter. But for ozone, this nonlinear chemistry, in major cities, you sometimes see elevated areas where ozone increases and the health effects worsen. So just to conclude across the study, when we've looked across the wide scope of literature and zoomed in on the studies that explicitly evaluate climate policies, we really found consistent conclusions despite a wide range of methods. And we talk in our paper about the different types of methods and models that are used in these studies as well. The monetized public health benefits fall within a range of about 50 to 250 tons per carbon dioxide reduced, which is consistent with previous studies. And really that the main thing that is driving these valuation studies are the mortality avoided from lowered PM2.5. So we're hoping that by talking about this more and getting the research out there, that there can be the opportunity to be calculating all of the benefits and costs together, and hopefully moving us toward decisions that are good for climate, air quality, and public health. Thank you.
Dr. Holloway, that was fantastic. That was really fascinating, very interesting, very illuminating. One of my first thoughts as you presented the introductory slides was, okay, so what are the obstacles? What are the barriers to even recognizing co-benefits? You pointed out that criterion air pollution progress is almost overlooked. So that seems to be one obstacle. What are the other obstacles, when you've pointed out so compellingly here of the importance and empirical evidence of the co-benefits?
Yeah, I mean, I think one issue is that from a scholarly perspective, often the folks who are looking at energy systems can calculate carbon avoided. That's not that complicated of a calculation when you know the carbon content of fuels. But anytime you start to move toward NOx and SO2, it depends what temperature the engine is running at and what kind of pollution controls it has in. If you're thinking about a truck, how fast is the truck going? I mean, it starts to get much more like in the weeds when you think about all these other chemicals. So there are some calculation barriers. I would say from a policy perspective, at the federal level and at the state level, typically energy and carbon decisions are made by the Department of Energy, the Public Service Commission, whereas states have environmental organizations that have been dealing with their Clean Air Act issues going back decades. So I think that there's also, from a policy and regulatory perspective, a bit of a divide. But I think the good news is that actually the EPA has been very proactive in trying to build the tools to make these connections more possible. And I think that some of those tools are the same ones that Neil Fan talked about with the kind of integrated modeling suite, but they also have simpler tools. And one that my team uses quite often for policy analysis is called COBRA, the cost benefit risk assessment model. It's quite easy to run, and it allows the quick calculation of the health and PM2.5 changes associated with county scale changes in emissions.
Excellent. Thank you so much for your thoughts at the higher level. We've got some great questions coming through Q&A that are specific details about your presentation. One question is, what percentage of the benefits from air quality improvement occur at these lower levels? That is, 1, below the NAAQS, and 2, at low concentrations that are most difficult to precisely predict?
Yeah, that is a really great question. And I'd say that, across the studies, it really depends where you're looking, what is the policy that you're looking at. And we did not find, or at least we didn't answer that exact question in our review article. So I'd have to go back and look at it. From the work that we've done, however, I'd say that, of course, you are getting a lot of changes at the low level. And we did a analysis of air conditioning use. And one of the things we found, of energy efficiency, I should say, of energy efficiency. And one of the things we found is that sometimes it is pushing a county from 1 over the NAAQS, the National Ambient Air Quality Standards, to 1 below it, which can make a very big difference from a regulatory perspective. The way that many pollutants are regulated is kind of like baseball, 3 strikes and you're out. For ozone, it's 4 strikes and you're out. And so if you can even be taking 1 day that would have been above and pushing it below, that can be a win for the county, for the regulators, for the from a policy perspective. There are other issues to say, well, maybe we don't want to give them a win because we want more health-based emission reductions. But just to say that these changes occur at all scales, and even sometimes small changes can have big impacts, win or lose from a regulatory perspective.
Fantastic. The Q&A is really heating up. We've got about 4 more minutes before we need to move to the next speaker. So we'll keep going on some of these more specific questions. One question was, do the calculations of emissions include all emissions across the life cycle of the energy source?
No, some studies do, but we really we did not focus and analyze the life cycle emissions. And one of the reasons is because when you're thinking about the health impacts, if there's mining that occurs in Wyoming, and then it's transported by train to Indiana, and then it's burned in a power plant in Indiana, those are affecting different communities with different populations in different ways. It matters if it was transported by train or transported by truck. And so we really focused on the emissions from the electricity sector, from the transportation sector, whatever the study looked at. If the study looked at the transport, we looked at the transport. If the study looked at electricity, we looked at electricity. And this is consistent with the way that the EPA currently regulates health relevant air pollutants. So we really tried to stay close to what the authors of the study did, and also frame it in a manner that was as policy relevant as possible.
Super. One question related to that, were you able to look at the health benefits of transportation tailpipe mitigation?
Well, in this, the benefits of tailpipe mitigation, I would say, are something that we have seen for decades. I mean, the introduction of the catalytic converter removed carbon monoxide from tailpipes. Cleaner burning fuels have removed lead from tailpipes. From nitrogen oxides are coming down all the time. So we did not focus specifically on a retroactive look at tailpipes, which we can see from the data is a huge success. That's why those lines are coming down. And we didn't focus in a proactive way on tailpipe emissions because we wanted to focus on carbon reduction strategies. And unfortunately, carbon is the one major pollutant that we can't pull out of the tailpipe. We can't pull it out of the stack. The only way to move away from carbon is to be moving away from burning the fossil fuel. And so I think that that was really the focus of our study, to think about those win-win opportunities to reduce carbon and other pollutants. But the question is absolutely right. You can reduce the other pollutants. And we have done that without paying much attention to carbon, which is good for health, but maybe a missed opportunity.
Fantastic. I'll ask one more technical question and a note to the audience. Thank you for your superb questions. We will have a chance for a moderated panel discussion, so you can also plan to save them for then. Was there one situation, was there any situation in which CO2 might be reduced without reducing PM or vice versa?
Yes, and I'll give one extreme example, which is one that actually I deal with in my own home and decision making, which is whether to have a fire in your fireplace or think about a natural gas fireplace. Let's just take that very simple one, but you could use this for any kind of cooking or barbecues. That if you're burning wood, that is a carbon neutral fuel, minus how you got the wood or driving it around and how, but the wood itself sucks carbon out of the air when it grows. You burn it and it lets that carbon back. It's a zero carbon source. But as it's burning, it emits a lot of smoke, nitrogen oxides, carbon monoxide, a lot of health relevant chemicals. Natural gas, on the other hand, does not emit smoke, and it emits less of a lot of other health relevant chemicals, but it's a fossil fuel and it's taking carbon that's been underground for millions of years. And as you're burning natural gas, it's emitting it into the atmosphere. So I think the wood natural gas conundrum is one that really does show that sometimes low carbon is not good for health, but for the most part, those are really the exceptions more than the rule.
Well, that's really clear, really nicely explained, Dr. Holloway. Thank you so much for the great presentation, and to our audience for excellent questions. I'm going to turn things over to Frank.
Thank you, Melissa, and thank you to Tracy for that fantastic talk. The third speaker in the session today, Dr. Rachel Morello-Frosch, is an environmental health scientist, epidemiologist, and professor in the School of Public Health and the Department of Environmental Science, Policy and Management at the University of California, Berkeley. Her research examines structural determinants of community environmental health with a focus on social inequality, psychosocial stressors, and how these factors interact with multiple environmental hazard exposures to produce health inequalities. Dr. Morello-Frosch received her Master's of Public Health in Epidemiology and Biostatistics and a PhD in Environmental Health Sciences from the University of California, Berkeley School of Public Health. Welcome, Rachel. Over to you.
Hi, can you hear me?
Yes, we can.
Okay, great. Can you see my presentation?
Yes, but can you put it into presentation mode?
Yeah.
It's very small at the moment.
All right, I'm going to stop share and try this again. Sorry about that. How's it look now? Does it look good? Okay. Yep. Sorry about that. It's a pleasure to be here, and it's great to be preceded by such excellent talks, because I think it segues nicely into some of the equity issues that I want to cover and some of the implications for climate change policy that's going on in my state of California, and that hopefully will influence the conversations we are having now at the federal level, now that there's opportunities to address climate change at the federal level. So I want to start out by sort of stating the obvious. A while back, when we were last considering federal climate change policy, we released a series of reports related to the climate gap to sort of lift up the conversation within the United States about the importance of addressing climate change strategies and greenhouse gas reduction goals, and kind of integrating sustainability and EJ goals as we move forward with policy, because these are really critically interconnected. I probably don't need to talk about the extent to which communities of color and the poor are going to suffer disproportionately, and are suffering disproportionately from the impacts of climate change that we're currently seeing now, whether we're talking about the myriad of extreme weather events, heat waves, climate sensitive infectious diseases, and what we're talking about today, patterns of air pollution exposure and the prospects of potentially exacerbating health inequities, in part because many of the emission sources are disproportionately located in communities of color and the poor. And I'm not going to talk about this today, but increasingly also we need to think about questions about generational equity. And in my research group and in other research groups, we're in California, because we've been so disproportionately affected by wildfires. We've been looking at the extent to which this affects birth outcomes. So one of the earliest studies to kind of look at this question, not only in terms of respiratory hazards, but also population effects on birth weights related to these extreme fire events that we're seeing in the western part of the United States. We observed in terms of exposures during the entire pregnancy associated with being pregnant during the Southern California wildfire, we observed anywhere between a 3 to almost a 10 gram population decrement in birth weight among women who were pregnant during that time period. And now much better work and more advanced methodological work is being conducted to assess the extent to which we're seeing these adverse birth weight effects. So it's an environmental justice question, and it's also a generational equity question when we're looking at birth outcomes. So I'm fortunate in that in my state of California, in 2006, we passed the Global Warming Solutions Act, which had very ambitious greenhouse gas reduction goals in the state. To get us below 1990 levels. And we were fortunate in that we actually exceeded those goals in this first iteration of the legislation. And then subsequently, we passed a renewal of that law to have even more ambitious greenhouse gas reduction goals in the state. And we are using a variety of tools to get there, which I'll talk about in a second. So as California was debating whether and how to pass a climate change law, the energy sector in the state really started to assess the profitability and the efficiency of many of their power plants. And so over a 10-year period, about 8 power plants were retired. 2 of them were coal plants, and then the rest of them were oil plants. And some of these had been the epicenter of a lot of environmental justice organizing and fights because of community concerns about their localized health impacts, including one in San Francisco and Bayview Hunters Point. So we decided to look at the extent to which these power plant closures might have affected, and can we see short-term health benefits of these power plant closures, because it presented us with a natural experiment. And our hypothesis was that, and as has been so clearly stated in the last 2 talks, that these power plants emit a lot of co-pollutants that we know very well are prejudicial to health and can contribute to premature mortality. But we're also concerned about these co-pollutants in terms of birth outcomes. So we did a difference in difference analysis to look at what happened comparing preterm birth rates, pre and post plant closures, and the extent to which we could distinguish that signal from overall temporal and spatial trends in preterm birth rates. And so one thing that we saw using air monitoring data was that, in fact, in different buffer distances from the power plants, we did see a decrement of PM 2.5 within 5 kilometers and a little bit within 5 to 10 kilometers of the power plants that were shut down. And most importantly, When we looked at preterm birth rates, again, using this difference in difference approach, pre and post, we saw an overall decrement of preterm birth rates, particularly within the buffer distances of less than 5 kilometers from these power plants, of about a 2% reduction in preterm birth rates overall. And this was most observed in later gestational ages. And then the interesting thing was when we stratified our data by the self-identified race and ethnicity of the mother, we saw even enhanced benefits, particularly among Asian and African-American mothers, albeit for African-American mothers, was not statistically significant. But it does, I think, raise, interesting environmental justice and equity questions in that some of these power plant retirements or climate change strategies may have potential not only to improve overall health outcomes and co-benefits, but maybe even have key implications for addressing environmental health and inequalities and environmental justice concerns. So we saw that these power plant retirements were associated with about a 2% reduction in preterm births. We saw that these benefits were slightly stronger for African-American and Asian mothers. And another study that we conducted, which I'm not going to talk about today, did show an increase in fertility rates as well during the post-plant closure period. So reductions in preterm birth and an observable increase in fertility rates after these power plant retirements. So in California, there's been a lot of effort to think about what are some of the best tools for achieving some of our ambitious greenhouse gas reduction goals. And so one of the main tools that we have is a cap and trade program, which regulates a series of entities. And so what industries used to be able to do for free, i.e. emit greenhouse gases, now they have to participate in an allowance program and acquire allowances for every ton of greenhouse gases that they emit. And this has raised, particularly among environmental justice advocates in the state, some equity concerns about a cap and trade program. In part because here's a scenario that EJ advocates have pointed out to policymakers that in general, greenhouse gas emissions from facilities, a ton of greenhouse gas reduction is the same regardless of where it is located and regardless of what the co-pollutants are that are emitted with those greenhouse gases from the different kinds of facilities. So here we have a scenario with, on the left, a power plant located near Bakersfield. Its PM10 emissions are about 41 metric tons, and it has about 1,000 people living within a 6-mile radius of that facility. And on the right, we have an oil refinery located in Torrance, California, and its PM10 emissions are an order of magnitude higher, and within a 6-mile radius, a much larger number of people. And so the concerns, the equity concerns are that these, in terms of looking at reductions, it's treated the same, even though the co-pollutants are very different and the populations living nearby are in terms of the actual numbers is very different. And so many, we decided to kind of address this more systematically in terms of the overall performance of California's cap and trade program to address this environmental justice question. And to what extent, how well did the first compliance period of California's cap and trade program perform in terms of localized reductions? And what is the potential to maybe make it better if we're seeing a less stellar performance, and to what extent are some of these co-pollutants correlated with the greenhouse gas emissions from these different regulated entities? So our first assessment was looking at the location of these regulated entities that are participating in the California's cap and trade program. And what you can see here is on the left in the orange bars is that a lot of these facilities are located in neighborhoods with higher proportions of residents of color. And then on the right, something very similar using California's spatial screening tool, CalEnviroScreen, which is used to guide policymaking and is used to assess the extent to which communities are disproportionately impacted by multiple environmental hazards as well as social vulnerability factors. And we can see that the greenhouse gas facilities that are regulated under cap and trade, many of them are disproportionately located in what CalEnviroScreen would categorize as disadvantaged communities. We also saw that there's a pretty good correlation between the emissions of co-pollutants and greenhouse gases from these regulated entities. It's not whether you're going up or down in terms of emissions, and that relationship varies depending on the category of air pollutants and using the CARB's air emissions inventory for these regulated entities. And then ultimately, what was the performance during the first compliance period of California's cap and trade program? And so this graph shows across different sectors. So the green is all regulated entities during this first compliance period. And then the different colored bars represents different sectors in terms of looking at the changes in annual average greenhouse gas emissions after implementation of the carbon trading program, and comparing before the program started and after. And so you can see that for several sectors and overall, localized emissions reductions of greenhouse gases and ergo co-pollutants, some of the performance of the cap and trade program was actually quite underwhelming, and kind of verified some of the concerns that EJ advocates have about how do we ensure that the health co-benefits of our climate change policies inure to the communities that have been disproportionately hosting a lot of these regulated entities for many decades. How can we ensure that we enhance the localized health co-benefits in communities of color?
Rachel, just a couple of minutes to go.
Yep.
Thank you.
So one of the things that has occurred in this debate about cap and trade in California is that even though this program is here to stay for the foreseeable future, it has generated funds to our general fund in the state, and EJ advocates came together to create what is now known as the Greenhouse Gas Reduction Fund, which is to ensure that revenues from the cap and trade program are invested in ways in climate mitigation and health co-benefit strategies that benefit EJ communities. And so it requires that 35% of the funds are invested for vulnerable groups, and that 20% are invested directly in these neighborhoods. And so CalEPA's CalEnviroScreen, which we collaborated to help co-develop, is a spatial screening tool that creates a variety of indicators to direct those investments in ways that can benefit EJ communities and maybe reduce the health inequities and enhance the health co-benefits of climate reduction strategies more directly in those communities. These are the indicators that are used in the CalEnviroScreen to identify disadvantaged communities and target those for investments. You can look at the ways in which the greenhouse gas reduction funds have been invested so far in these communities. There's been about $11 billion appropriated to date, and you can look online at all the different kinds of programs that have been supported in this effort. And so I want to end with this because right now the Biden administration is promoting its Justice 40 initiative, which is very much aligned with kind of the strategy that California has taken. And they are in the process of developing, again, a screening tool similar to the one we have in California, CalEnviroScreen, and hopefully learn lessons from what we've done in California and in other states to enhance the co-benefits and also to address environmental justice concerns related to climate change. Thank you.
Thank you very much, Rachel. That was very interesting, and we know that California has been, pioneering in this area, from several decades now. The study that you mentioned, where you looked at the pre and post closure of the power stations and the benefit to preterm births. There's a question has come up about, and maybe it's just because you didn't have time to show it, was there a measurable change in PM pollution as a result of those closures?
Yeah, so in the slideshow, we did, using air quality monitoring data, we did see a concomitant decline in PM 2.5 levels that in the wake of those power plant closures. So we weren't able to measure it directly in our study.
Was it sizable?
Pardon?
Sorry,
Pardon?
was it a sizable change? Was it a sizable change in concentration?
Yeah, I mean, it was, yes, but again, we just looked at air quality monitoring data, so we couldn't totally separate it from other kinds of reductions that might have occurred during that period. So we weren't able to make that direct connection, but yeah.
Okay, and then there's a question here which is complimenting you on the methodological approach for using differences for measuring outcomes. And the question relates to, did you look at anything else beyond preterm births, for example, maybe emergency department visits or even mortality?
No, we did publish another paper looking at fertility rates, and we did, which I did not have time to talk about today. And we did observe an increase in fertility rates during that period, but we did not look at hospitalizations or ER visits.
And then just finally in this session, are the power plants the biggest contributor to pollution for minority communities? And if not, what are the other contributing factors?
So because now California has shifted and closed down a lot of the dirtiest plants. So a lot of those 8 plants that I showed you were some of the worst in the state. And a lot of the companies, when they saw the writing on the wall that we were going to be more heavily regulating greenhouse gases, a lot of those plants, I think it was decided that they were going to be less efficient to run. Power plants are still an issue in communities of color and low income in the state. Many of them are gas fired, but there are other facilities related to fossil fuel production, both on the extraction and production side, as well as on the refining side. That's a huge concern for communities of color. And then some major industries throughout the state, manufacturing and chemical manufacturing. So it's pretty diverse in terms of the different types of regulated entities that are disproportionately located in communities of color and the poor in California.
Okay, well, thank you very much, Rachel. We have a number of other questions, but I'm going to hold them over until the main Q&A session for you. So passing back to Melissa.
Thanks so much, Frank. And that was a really fascinating presentation, Dr. Morella Frosch. I'm really delighted to introduce our final speaker, Sonal Jessel. She's the Director of Policy at We Act for Environmental Justice and is responsible for advancing the organization's policy agenda at the local, state, and national levels, in addition to leading the New York City policy initiatives and the Northern Manhattan Climate Action Plan. Prior to joining We Act, she conducted research in energy and security, housing, and public health at Columbia University. Sonal holds a Master of Public Health and Population and Family Health with a concentration in climate and health from Columbia University's Mailman School of Public Health. Her interests focus on the intersection of environmental and social justice, health, and policy. Sonal, please take it away.
Thank you very much, Melissa, for your introduction. And let me just pull up my slides quickly. Here we go. So it's been a pleasure hearing what everyone has to say, and I think it makes sense that I'm the last person to speak, because I think it's going to help show where some of this research, I guess, gets actualized and how it looks on the ground once we take this information and move forward in advocacy with it, or how we collect information from community members, which is so important to this. So thank you to all my speakers beforehand. It's been fascinating. So, oops, is my slide changing? There we go. So I'm talking about extreme heat today. That's what I'm going to be focusing on, because that's an issue that We Act for Environmental Justice focuses really heavily on lately. So just a quick introduction to We Act. We are a community-based organization, grassroots organization based in Harlem in New York City. We have been organizing to build healthy communities in Northern Manhattan since 1988. We Act got its start when Harlem residents, including our co-founder and current executive director, Peggy Shepard, and 6 other people, we were motivated against a sewage treatment plant being placed in West Harlem in a community that was already dealing with the brunt of a lot of other toxic facilities being placed in their neighborhoods. And this sewage treatment plant was spewing lots of nasty toxins that, you could smell it apparently very clearly. And so they mobilized their community. They did direct action. They became very involved civically in how they can shut this plant down. And what resulted was basically a settled lawsuit where we were able to establish We Act as an organization, as well as get a park where the sewage treatment plant is. It's literally on top of it, and get the plant cleaned up and closing off the emissions that were flowing into the neighborhood. So We Act has kind of been working with this model from there on out, where we embolden our communities, we increase advocacy in our communities that we represent, and we, with members of the public, we advocate for policy changes that address what we consider to be environmentally racist policies and programs. So extreme heat is one of them, and it's been growing, of course, as I think all of us in this call know, in severity, frequency, and duration, especially a place like New York City, which deals with the added burden of the urban heat island effect, which is true in a lot of places across the world, where our cities are trapping our heat, are leading to have much warmer days and nights on average than our rural areas. And so New York City deals with that in a big way. We have high humidity in the summer, which really contributes to a terrible feeling of stickiness and discomfort and really serious health impacts. So extreme heat is the #1 weather-related fatality in the United States. A lot of people that work in extreme heat think of it as like the silent killer, because it's just less in the news about how many people are really actually dying from extreme heat. It's a huge number. It's just hard to count. It's hard to report. It's hard to attribute to it very easily, but it's really there, and it's a growing issue majorly. Why does We have to work on it as an environmental justice group? We do consider this an environmental justice issue. We consider extreme heat particularly a climate justice issue. And that is because there are communities across the world, particularly in New York City, that we think of, that are bearing the burden of extreme heat impacts and have higher extreme heat vulnerability than others. So while we all feel the brunt of extreme heat, I take this quote that I actually don't know who said it, but it is a quote, that we might all be in the same storm as extreme heat, but some people are dealing with the problem at much higher levels. And so this is just a little rundown of who those folks are that we consider to be disproportionately impacted and why. First, this is a list of people we generally think about in terms of who's impacted by extreme heat. people that are older, children, people with chronic illnesses like respiratory illnesses, people that are pregnant, and people that are constantly working outside and exposed to the heat for a long time. While those things are true, there's a whole other subset of people that WEAC thinks about that are particularly vulnerable. So these are kind of the basic, of course, kind of the, oops, I revealed too soon. The basic things that contribute to heat-related illness: being outside for too long, limited air movement, not enough water, physical exertion, you know, your health conditions, your pre-existing health conditions, pregnancy, all contributing to heat-related illness such as heat stroke, heat stress, dehydration, whatever it might be. Like premature birth is now something that people are talking about, and you know, it has a big connection to heat. There's so much more to the story than this, and that's what WEAC focuses on. So when we do work around extreme heat, we're thinking about the way that our neighborhoods are built, or the way that our houses are maintained or not maintained, that make people more or less likely to be subject to extreme heat. And this is why we focus on extreme heat, because we have a huge subset of people in Harlem and Washington Heights and Inwood that are living in buildings that are very poorly maintained. And that is considered to be an environmental injustice for many reasons, and housing injustice for many reasons, some of which is, you know, a huge concentration of public housing that is up in Harlem that has over the years been devalued and under-resourced and had money taken away from them over the past 50 years, chronically, leading to living conditions that are not healthy and that are very unfair. And that is, you know, particularly because we have lower income people, we have particularly Black and African American people living in these households. We also have crowded apartments with intergenerational living. There's a lot of people, you know, sharing rooms, living in small apartments. It's a major concern in New York City, particularly health-wise. That's something that helps spread infectious diseases, very relevant right now. It's a major issue. We also have people living in neighborhoods with less green space and more air pollution, industrial sites. All of that has to do with the built environment of the neighborhood. I think a lot of you have probably seen the research connecting redlining to increase in extreme heat vulnerability, that neighborhoods that have been formerly redlined have around 5 degrees warmer than other neighborhoods. We definitely see that across New York City in neighborhoods such as Harlem that have a higher heat vulnerability index. And that is due to, you know, less green spaces is really one of the big things that people point to. There's a little bit less of a good tree canopy. There's fewer parks that are that have greenery. We have parks uptown that are concrete. That doesn't really help us when it comes to the heat. And then we have the neighborhoods with air pollution. We have a lot of bus depots. We have train yards. We have power plants. We have a lot of facilities that are just spewing toxins and spewing heat with that. And then the other risk to extreme heat is people exposed to air pollution across the lifespan. That's something that's definitely been in conversation since the pandemic began, where people that have been exposed to air pollution across their lifespan are found to have more severe cases of COVID-19. And there's a very clear connection to that and extreme heat as well, where you know, we've talked to residents who said that they don't go outside on a hot day because they can't really walk more than 2 blocks without their asthma acting up on a really hot day, for example. And then it comes to the sort of system stuff. People are stretching their resilience across a lot of different hardships. So that's where, you know, Dr. Diana Hernandez calls the resilience reserve, where, you know, people of color, lower income people have a lot of resilience. And unfortunately, though, that is stretched across a lot of things. So you can only be so resilient when it comes to the fact that you just have a lot of systematic things that you're pushing up against it, and you're constantly dealing with and constantly having to expend yourself to make ends meet, such as our food insecurity. Our rent is a big problem in New York City, chronic illness, and now we have COVID-19. Concerns about your immigration, concerns about all of these different things, and just financial hardships generally, leading people to really be more susceptible to impacts that are related to extreme heat. So we have to think about extreme heat as an environmental racism issue. Everything we do is around environmental racism, and that we are really focused on what are the health impacts of these environmentally racist policies and programs. We think of climate change and then extreme heat as just exacerbating the problems that already exist. People are already dealing with trouble paying their electricity bills. As extreme heat gets higher, having to pay more money on your electricity bills is just making the problem worse, but that problem did already exist. So we really think of it as something that's just amplifying a lot of these issues. So since COVID-19 hit, there's just been a lot of challenges, especially in the summertime. This is a reference to a 2020 graphic, but it's probably going to still be relevant this year as well. So we've done some community-based participatory research around how people are dealing with extreme heat. And what we found is again, it's just accenting a problem that really already exists and just making things much worse for people. So while people are already burdened by air pollution and asthma, extreme heat just makes that worse. While people are already burdened by having to pay their energy bills, extreme heat just makes that so much worse. And continue and on and on and on. There's a lot of ways you can talk about it. You know, people having to stay indoors instead of go to you know, the places that they normally go to cool down is a major barrier for people's health. Last summer and again, it will be this summer as well. So what we've decided through all of our community-based research, we held a lot of different listening sessions with people where we really asked a lot of open-ended questions and then some more specific questions around how are you dealing with the heat? What are the barriers you're seeing? And this is over 100 community members across northern Manhattan, neighborhoods of Harlem, Washington Heights, and Inwood. And the thing that we heard the most was around the topic of energy insecurity, which is defined as the inability to adequately meet your home energy needs due to a lot of different things. There could be physical conditions of the housing, energy costs, coping strategies. So it really touches on the physical, the economic, and the behavioral, this term energy insecurity. And so what we found is that is the main concern, and that exists whether we're talking about energy insecurity within the home or energy insecurity outside of the home. So when I refer to outside of the home, I mean things like cooling centers and spaces where people can go to cool down, or you know, if they go to someone else's houses, or if maybe they would go to a museum or a movie, not being able to access that adequate energy as well is now becoming an issue when it comes to COVID-19. So we're really concerned about people being able to adequately cool down. You know, the research that has been done over the years, and especially specifically in New York City, our Department of Health found that 80% of the deaths due to extreme heat happened when an AC was not on or was not present in the home. So we know that having cooling is the key to preventing extreme heat death and hospitalizations, which is really our ultimate goal here.
We have just a couple more minutes, Donald. Just a couple more minutes.
Great, I'm perfect. I'm almost done. So these are some of the health impacts that we think about when it comes to energy insecurity, and this is kind of reference to some of the research I did before being at WEACT, but we kind of really took the time to show how much all of these sort of hardships and cumulative impacts are related to each other. If you can't afford energy bills, if you don't have adequate temperatures inside your home, if you don't have access to energy, whether that be because the city had a power shut off or because the energy bills are too high, it relates to food insecurity, it relates to housing insecurity, it relates to good ventilation, and then there's a lot of health outcomes that come with that. Immune function is something people are worried about, poor sleep quality, psychosocial stress is a major one as well. So this is why WEACT is really pursuing extreme heat, and why we think this is so important is because we think everyone has the right to a healthy home and a cool home, and really particularly we ideally want a sustainably cool home, like not a cool home that's taking up a lot of energy and contributing to climate change, but one that is energy efficient as well. So that's something that we're really working on and pushing for advocacy-wise is how do we get people that are lower income, people of color that have dealt with the brunt of extreme heat, how do we get them to be safe in their homes when it comes to extreme heat? So I will skip that for time. So this is just like one picture and quote of some of the things that we were hearing in our listening sessions around extreme heat when we asked like what's going on. People are very aware of this issue of extreme heat. There is sometimes an issue with risk perception. It really depends on the population you're asking, but it seems that mostly we have a lot of community members that are very, very aware that not enough is being done to protect them against the heat. And this is like one quote that really hit me that I was like, wow, they're really sure that the city and the state and the federal government isn't quite doing enough for them. So that's why we act as advocating for extreme heat changes. We want affordable cooling in your homes. We want affordable cooling outside of the homes. We also advocate for a lot of mitigation and adaptation measures around extreme heat for neighborhoods as well as individual households. And this is ultimately what we're pushing for. And this is my last slide, that we need protection for people who are not given the protection historically. We need people to feel safe and healthy in their homes. We need people to feel safe and healthy outside. And we look at this as a very intersecting comment because we heard from people in the summertime that, particularly Black and African American community members that we asked said, they weren't feeling safe going to parks where, due to heavier police presence that was there over the summer last year in New York City, in certain parks in New York City, for example. So there was concerns about safety that were beyond just extreme heat, but were clearly intersecting in issues and accenting the problems that were existing for people. So this is kind of why we're pushing this overarching message of like, let's get people safe in the summertime and we need to do it sustainably. So that is all. Thank you all very much. Happy to take any questions you have.
Sonal, that was fantastic. Thank you very much. Very fascinating, that graphic of describing what an energy secure home is. Really powerful and a great source of health communication. We are a bit tight on time, so I'm going to just ask a clarifying question for our audience, and then we have one other question that should be pretty quick. The clarifying question is that we do have an international audience. So if you could just describe or give us a brief definition of what redlining is, because it's a very American issue. And then secondly, we have a question from our audience asking about New York City. And driving in, this person says that they see lots of housing right up against the highways. And the question is we act concerned about housing right close to highways where there's likely to be higher levels of air pollution?
Yes, both great questions. And so I'll say redlining is a very complicated policy issue, but I'll say just very overarchingly, it was a practice in the mid-1900s where essentially certain communities were reserved for white people, and particularly government was creating policies that kept Black and African Americans from buying households or living in certain neighborhoods. So it was very much a racist policy. And then on the flip side, they determined certain neighborhoods that weren't worthy of investment. And so that was the Black and African American neighborhoods. So when I talk about not enough green space in Harlem, that's because that neighborhood, which was particularly and still is a Black neighborhood, wasn't worthy of that investment of green space. So it was a very racist practice. And we're still seeing a lot of impacts from that now. And then for that other question, yes, there's a lot of public housing along the highway in New York City, particularly where we work in East Harlem and Central Harlem. There's a major highway along the water, and all the public housing is right along there. So yes, we are very concerned about that. That is one of the main things that we think about. And we do a lot of specific advocacy work around public housing and healthy housing for our public housing community members.
Thanks so much for the really interesting and informative presentation, Sonal. And Frank, I'll turn things over to you to kick us off with our moderated panel. If we can have everybody come on camera, and we've accumulated a number of questions. So let's see if we can work through those questions from our audience.
Thanks very much, Melissa. So that was 4 really interesting talks, and we have a range of questions to put to you over the next 15 to 20 minutes. I want to start by just obviously reminding you all today's session, because of limited time, was very much focused on North America. And we have these challenges and issues right across the globe. And 2021 will see a major focus on this issue in the UK, where we will be hosting COP26. And although there is increasing recognition of important links between climate change and air quality, I think we still have a lot further to go to achieve all those win-win situations. So that's really the first question that was brought in by Simon Burkett here in the UK, and he pleads to all of us to keep bringing this issue up over the next few months, so that we can really get a good focus on it when we go to Glasgow later in the year. I don't know if any of the panel would like to come in with any thoughts around that. Neil, over to you.
Not to put me on the spot. Frank, I think I might have lost the thread on what the specific question is. I apologize.
So really, just how do we use the COP26 to ensure that we not only deal with climate change challenges, but we also have a win-win situation with air quality? Sure.
So I think what's clear from today is that there is a obvious link between air quality and climate. And I'm speaking only about my own research and that of my colleagues, because that's what I'm most familiar with. But I was surprised by the extent to which there is this such a strong feedback loop between anthropogenic emissions and air quality, and how that can mitigate climate change. But I have mixed feelings about that finding, in part because I don't want it to imply in any way, of course, that means then that you can essentially just simply reduce anthropogenic emissions, and that will make any sort of negative effects from climate, particularly in air quality, go away. So I think it's reasonable to say that additional reductions of CO2 are warranted, and I think pretty critical.
Thank you. Over to you, Melissa.
Sure, I've got a question for Dr. Holloway. Since many studies indicate a lack of health effects thresholds, and most of our analyses show that, or your analyses show that most effects of air pollution occur at moderate to low levels, could you comment on the likely scale of results that don't focus on the worst days?
Yeah, I'd say that when in my group we've done studies, and in most of the research that we've reviewed, they apply the health benefits at all scales. And just to sort of restate it for others, is that the suggestion is that a 10 micrograms per meter cubed reduction might have the same benefit whether you're going from 20 to 10 versus 60 to 50. And so, there's of course some uncertainty about how those changes scale at different levels of exposure. But when the monetized values are put forward, they don't take a threshold into account. And so really, when looking at the benefits, you have different lenses to put on it. Some people are interested in those monetized benefits, or particular health outcomes like birth impacts or respiratory disease. And others are interested in what it means for a particular regulatory framework. And so, I think that the different studies apply different lenses. And I think this is sort of where, back kind of to Frank's point about integrating this into COP or to kind of larger scale assessments, I think that if from an assessment perspective, that offers the opportunity to look at something with all lenses. We were really just dependent on what the authors chose to do in the studies they published.
Very helpful, and thanks so much for making that connection to the COP message and also a broader global perspective. I'll turn things over to Frank.
Thank you. Rachel, has there been research efforts to understand or quantify the impacts of clean energy transition in California on disadvantaged communities? And as we look forward into the future, as emissions reduce, this issue of energy justice is clearly going to rise.
Yeah, so we haven't started that yet. We are looking to begin launching some projects related to that and collaborating not only to look at air quality and environmental health benefits, but also the extent to which the economic benefits of this energy transition could be quantified in terms of health benefits. And again, I think it requires a multidisciplinary team to do it well. So folks in the fields of economics are going to be key to that going forward. So there's stuff ramping up, but to my knowledge, we haven't seen any studies yet on it. It's a little premature, I think, in California.
Okay, thank you. Back to you, Melissa.
Okay. We've got a question for Dr. Holloway. It's good to see countrywide pollutant concentration averages are decreasing, as you mentioned at the beginning of your presentation. However, and this is a larger international perspective, the US is large and mostly low population density. Have criteria pollutant concentrations decreased when weighted by population density?
That's a good question. And really the answer is yes, because almost all of the monitors that provide the data I showed are located in urban environments. Some are in rural, some are suburban, but they're primarily located in densely populated areas. So that's actually where we have the most data from. And studies who have done population weighted averages also find that it's decreasing in the US.
Great, thank you. Frank?
Neil, there's been a lot of focus on obviously transport emissions, both CO2 and burning of fossil fuel and pollutant emissions. Should the introduction of electric-driven automobiles be accelerated from current policy assumptions, or are there other preferred options to reduce climate and air quality impacts?
It's a great question. I'm not in a really good position to be advocating for or against specific policies, but I think to build upon Tracy's previous observation about the long-term secular decline in air pollution in the U.S., that has a lot to do, of course, with the change in the distribution of and composition of the electricity generating unit sector in the U.S., the transportation sector. It's reasonable to expect that as we make this transition in the U.S. and elsewhere from gas-fired vehicles to electric vehicles, that's obviously going to yield both climate and air quality benefits, to be sure.
Thank you. Back to you, Melissa.
Sure, I'll ask a question for Sonal Jessel. And I had this as well, as you were describing the complexities of extreme heat and also the awareness and even the diagnosis. We know that oftentimes it's many causes of death and extreme health issues, acute health issues are lost in being attributed to extreme heat. This audience member also asks what temperature is considered extreme heat, and is there a relative humidity component to the definition? And so perhaps the way that we ACT thinks about it, and any of other of our panelists that are looking at heat would be interested in that information.
Yeah, thanks, Melissa. So we follow the city's guideline for extreme heat and their definition for most of the work that we do, with a caveat that I will add at the end. They go by heat index, so that includes humidity and temperature. And I believe that they consider an extreme heat day, or a day to put out some type of heat emergency or heat advisory to the population, is when there's 2 days that are I think 95 degrees, or 2 consecutive days, or if any day reaches 100 to over 100, that's a heat emergency day, and that's heat index. And the caveat that I'll say is that talking to community members, they would appreciate a heat emergency to be at a lower temperature threshold than that. That's extremely high, and people are feeling the brunt of extreme heat at a lower level. So that's something that we have started to think about and explore if we want to have that discussion with our partners in the city agencies around lowering that threshold for heat emergencies. And the importance of that is because cooling centers in New York City only open, or certain programs only open when a heat emergency is declared. So it is important to have that declared in order for some people to be able to access some of this extra help. So that's why we're thinking about advocating for it to be a lower level.
Great. And if I could also follow up related to that, you mentioned in one of your slides about occupational groups. And so my question is, to what degree is there an awareness on the part of the city? Are you hearing from construction workers? Are you hearing from first responders and police to explain that they're working outside all the time and they're incurring major consequences of heat? And how does that help getting your message across, or what are the barriers?
Yeah, we're hearing like mostly, I think the group that we're mostly hearing from is like delivery workers and construction workers. We do a lot with construction workers because we do have a program around building green jobs, like particularly solar installation jobs. So we have a lot of construction workers that we talk to, and they have voiced that concern around extreme heat and working all day in the heat in the summertime. And so we do definitely use that as a point of advocacy. And that's also true across the United States. I mean, we also always hear that conversation about farmers in the West Coast or the west side of our country working in really terrible extreme heat conditions, and their working hours being very interesting because of that. So yeah, we definitely use that as a point of argument. And there's even a bill that New York State is potentially moving forward around workforce safety for people working in extreme heat. That could be interesting. So yeah, it's an important point.
Thanks so much for your responses. I'll turn over to Frank for other questions.
Thank you, Melissa. Rachel, because of time constraints, you didn't really have a chance to go into the work that fertility rates were observed to increase following the natural experiment involving the closure of the power stations. I thought there was it both male and female rates which improved?
We were looking at female fertility rates only.
Okay. And another question here from the team. Can the Cal and Varro screen tool be replicated for other states?
Well, so there are other states that have been trying to develop their own screening tools. So New York's been working on this, New Jersey, Minnesota, and so the short answer is yes. And I think a good screening tool is only as good as how much data you have to go into it and the quality of that data. So we're very fortunate in California that we are a very data-rich state. It's frequently updated. And it is available statewide. And as I mentioned at the end of my talk, part of Biden's executive order on addressing climate change is to build upon US EPA's EJ screen to develop a more robust screening tool that is around climate and economic justice to inform decision-making about investments in disadvantaged communities across the country. So I think that is going to, many people are starting to work on that in the administration. US Digital Services getting involved, and I think that the challenges will be there in terms of interagency cooperation to cultivate the data sets necessary to make that national screening tool robust.
Thank you, Rachel. Over to you, Melissa.
Thank you. I have a question first for Dr. Holloway, and then a second question that's both for Dr. Holloway and Dr. Pierce. So it relates to solar, and I remember in your presentation you explained about the benefits of solar, and I wanted to ask if that was estimated based on current solar energy use, or is there a way to project? So that was one question. And then for both Neil and Tracy, to what extent are the US federal and state policies integrating co-benefit approaches with respect to action on air quality, climate, and health? So one technical question about the solar modeling in Dr. Holloway's data, and then both for both of you, Tracy and Neil, to talk about the policy implications of climate and health and action and air quality.
Yeah, so that's a great question. Our study on solar energy was really a what if question, thinking about a scenario where almost 20% of electricity in the eastern United States were from solar, which is much higher than it is now. Our scenario was developed in collaboration with the National Renewable Energy Lab, who at the time had done a study on the maximum level of cost-effective grid stabilizing solar energy. And this is a number of years old. Solar is changing rapidly. One of my colleagues here at Wisconsin, Greg Nemeth, wrote a book on how did solar get so cheap. It is really changing fast. So I think that the scenario we might do if we were doing this today might be different than what we did a few years ago, but it was based on a cost-effective solar scenario coming out of the National Renewable Energy Laboratory. To the question of how much states are currently integrating this, states have a very robust and well-developed plan for a compliance with the Clean Air Act and meeting air quality obligations. But for the most part, climate solutions and energy investments are not part of this process. I taught a class a few years ago that surveyed what every state was doing to see whether climate and energy solutions were integrated with their air quality planning. And at that time, the only state that had actually done so was Texas, which had integrated energy efficiency in their Ozone state implementation plan. SIP is the context where states tell the EPA how they're going to meet their goals. I think though things are changing. They were really on the brink of a change with the Clean Power Plan under the Obama administration, which would have brought the air quality planning and the climate planning together. That was really put on hold, of course, under the last administration. And I think that now we'll see what happens. And certainly Neil being at EPA could probably expand further.
Sure. Yeah, just to build on Tracy, what you noted, I think that there are both practical challenges as well as methodological challenges associated with integrating climate and air quality in terms of developing state implementation plans, for example. There are a suite of well-established tools and techniques for quantifying both climate and air quality impacts, but they tend to be resource intensive to use, with the possible exception of the COBRA tool that you spoke of earlier. And I think methodologically, I didn't get a chance to touch on this during my talk, but when we're thinking about air pollution related effects or even climate related effects in the future, we're drawing upon epidemiology literature that is itself inherently retrospective or observing historical changes in air quality and relating those changes to the risk of some adverse effect. So I guess where I'm going with this is I feel like there's more work to be done to perhaps think more about what specific epidemiological evidence we use for quantifying those risks, certainly. And I'll just stop by also noting, I think that there's potentially some work to be done on joint effects of air pollution and temperature. By tradition, or perhaps because of data availability, we treat those as being separate. But I think that there's potentially some synergism that we're missing out on by not treating them as the joint effects that they are.
Neil, thank you. And Tracy, thank you. I just wanted to apologize. I misspoke. I referred you to you as Neil Pierce, who is an environmental and occupational health colleague, also very respected and appreciated. But my apologies for that. I think we are almost at time, Frank. What do you think?
I think we have to move on. Let these good people get on with their day. So I'd like to just finish up by thanking all our speakers, all our listeners or registered guests today, and the many, many questions that were put to us. And we will try and obviously look into those further. We didn't manage to go through them all, but really, I think it's been a very, very interesting meeting and clearly a fantastic choice to start off this year's HEI annual webinar series. The issue of climate change is the biggest one probably that we face from a global viewpoint, and quite clearly there are major impacts on air quality, and we all know that air quality and air pollution has a major impact on health. So for the health of our populations, this is something which we need to get right. We need to get it right because it's going to require considerable investment, bring emissions under control, and to gain the benefits of that investment, we need to have obviously the health benefits down the line as well. So we heard from 4 speakers today, all fantastic presentations. We started off with Neil, and he took us through some of his recent science policy research around the climate penalty, as he described it, and how will climate change impact directly on air quality. And he described work which looked at 2 emissions inventories, one in 2011 and one in 2040, and the potential impact across the air pollution arena, focusing in on PM 2.5 and ozone changes and the projected impacts on health of those changes. And clearly that work is probably in its infancy, and there's an awful lot more that needs to be done, as Neil told us about. But I like the way he finished off his presentation by focusing in on those future research needs. And that is clearly an area which we hope the HEI will be able to fulfill in part and play a major role in funding new studies which will increase and improve our understanding of the relationship between climate change, air quality, and health. Our second speaker was Tracy Holloway, and Tracy eloquently described work which she had undertaken with one of her recent PhD students, Callum Gallagher, and really reminded us that we're not in a terrible situation, because we have this history of actually already dealing with air pollution. Well, at least in North America you've got a very good track record. As we look across the rest of the world, of course, there's a lot of catching up to be done, but there are clearly decisions, mitigation actions that can be taken to improve air quality. However, it's very expensive. And again, any investments we need, they're going to have to be sound investments, and we need to be getting the ultimate benefit from them. Tracy described her work with the Omni satellite data, which has been really beneficial to move this field forward in recent years, especially again moving outside North America. Think of all those countries that don't have good monitoring systems and how we're beginning to gain insights of pollution challenges that they were having as well. But we were reminded of that, there's co-sources of carbon dioxide, and there are certain criteria pollutants, and therefore if we deal with one, we hopefully will be able to deal with the others as well. And there's a whole spectrum of potential co-benefits which we will gain from reducing fossil fuel combustion. Our third speaker, Rachel Morello-Frosch, again dealt with a slightly different but important component of this whole story, and that's integrating justice and sustainability into climate change policies, and illustrated the work that's been going on in California on this particular issue. She reminded us that poorer members of society and people of color often suffer disproportionately from climate change impacts. She used her own research around wildfire impacts on birth outcomes in California, and clearly there's a lot of more work that needs to be done as we increasingly face this challenge across many countries. She described the equity concerns around cap and trade system, but how the benefits of that can be used to actually set up greenhouse reduction fund investments which can benefit the poorer in society. Our final presentation then was for Sonal Jessel, and Sonal reminded us of this particular issue associated with climate change, and that's temperature increases, heat-related illnesses, and the numerous examples of that's out there. And of course, as in many challenges, we have susceptible groups and members in our population: older people, children, those with chronic disease, and perhaps those even working outdoors on a regular basis. All need special attention, as does the community structure, the building types we have, the availability of green space and blue space in our communities, and just to be aware that there are certain communities where the challenges will be much greater. But we know an awful lot about these challenges, and therefore, if we can get the right policies into place, then we can help these vulnerable groups and try and rebalance some of these injustices. So that is a quick, rapid summary of what we heard today. Clearly, we're only at the beginning of a journey here. And as I've said already, I think the HEI have got a major role to play in this. And certainly we will be encouraging to do so, won't we, Melissa?
Most definitely, Frank, most definitely. Yeah, very gratified by all of this work. And that was a superb summary. And I'm really heartened to be able to work with you as part of the contributions to HEI. So I guess we want to extend a deep appreciation for the commitment and all the work that the members of our audience do in this area as well. And I'm sure the panelists will welcome follow-up. As was mentioned, we will be posting the recording of this session, and we have several other sessions that are forthcoming from HEI as part of the annual conference. And so I want you to stay tuned to this space.
Thank you, everybody. I just wanted to note one more time that HEI will make the webinars available on YouTube in the coming weeks. So you can check out our website for details. Our next webinar is on Tuesday, April 13th at 10 a.m. Eastern Time, and it's Environmental Health Research and Communities, Stories of Successes and Challenges. And we'd like to thank you for taking a few minutes to complete the post-webinar survey that you're going to be emailed. And here's a list of our upcoming webinars in our 8-webinar series. So we hope you can join us for all of them. Thank you, everybody.
Thank you.